Hey everyone, today we're talking hamstring strain. So the biceps femoris, or the outside hamstring muscle, is the most commonly injured. There are two main mechanisms for this. The first is a tear that occurs during the terminal extension phase of the lead leg during running, as seen here, and when the knee is forced into terminal extension. Our first goal of rehab is to restore knee extension range and start to get strength into the hamstring. Now we can do this with the extender exercise, which is part of the Asplin protocol, which uses eccentric strengthening, which is primarily the main function of the hamstring muscle. The second exercise to progress to is then the diver. Standing on your sore leg, we want to extend out slowly, applying the eccentric force to the hamstring, getting nice strengthening and lengthening. We can then look to apply more speed to make the exercise harder. The final exercise is the glider. Standing on the affected leg, we want to slide the non-affected leg out, which places the eccentric load on the right hamstring. Once you've finished your rep, use the prop to pull yourself towards the start position so that you're not having to work concentrically during this exercise. Hey guys, besides eccentrics, early on we can promote strength and reduce symptoms with long isometric holds, where we contract the hamstring without actually moving the leg. We do this at a comfortable intensity for 45 seconds. It's a good idea if your hamstring is quite irritable and you're finding it hard to begin the rehab process. As per the video, begin in a bent knee position as symptoms allow, slowly progressing to greater ranges of knee straightening, as these positions are more painful. Generally speaking, the act of straightening your leg is the most painful thing to do with a hamstring tear. So we can start by doing concentric only exercises as seen here to strengthen the hamstring without much of the pain of lengthening. Once we can tolerate this, we can go to eccentric or lengthening exercises to work on that component and then put it all together with both concentric and eccentric once we can tolerate the first two steps. When you are able to do this, it's time to add more load. We can do this by adding a band, adding an ankle weight, starting to use some seated machines, whatever equipment you have available. As seen here, you can get quite creative with your hamstring rehab early on. G'day guys, so let's look at how we can add in load early on after a hamstring tear. We're going to continue on with the bodyweight movements initially, just doing a offset Romanian deadlift with bodyweight for 20 reps. Once we can handle this, we're going to go and add load. So in this case, using dumbbells. Progressions are obviously dictated by pain during. Now we're okay with a little bit of pain, maybe like a 3 out of 10, but certainly not a lot of carryover pain 24 hours later. We can also add in weight in different ways, such as using the barbell. I really like adding in lots of single leg load early so that we get used to increasing the load on the leg by itself and making the leg work hard by itself. Obviously, we've done a few exercises earlier in the first video, so still using the extender, still using this diver here, and of course using the glider third exercise as seen at the end. But these first exercises seen in this video are a nice progression from these exercises. So please let me know how you go in the comments below and keep listening for the next video. Let's continue on with hamstring tears, guys. So in this video, we're trying to get more load through our hamstrings, but in a bilateral nature so that we can get back to some of our favorite compound exercises in the gym, such as squats, Nordic hamstrings, and stiff-legged deadlifts. Starting with bodyweight good mornings and then moving on to banded good mornings, as seen here, is a great way to get appropriate hip hinge and developing even weight between legs. The good mornings are a great initial transition exercise as there's more resistance at the top of the movement where the hamstring is relatively safer and less resistance at the bottom of the movement as the band comes on slack. The reverse can be said for the dumbbells, which are a little bit more uneven, and there's more weight on the hamstrings at the bottom of the movement as seen here. And similarly, the same is true for the barbell, although the barbell is likely easier as there's only one object to control. To develop a good hip hinge, start by setting your shoulders back and bracing your trunk, preventing segmental movement of the torso. Then by flexing forward at the hips, start lowering the bar down in a straight line. We want to have our knees in a slightly bent position, but don't let them push forwards during the movement, as doing so will change the vertical bar path. For our injured hamstrings, we can't forget to strengthen the entire body, as it isn't always just a weak hamstring that causes injury. Getting back into compound movements like squats are a great general lower body strength exercise that also requires lumbopelvic control, even weight distribution, and overall a general body awareness to complete the movement. Begin with bodyweight squats with perfect depth control and weight distribution for reps, then progressively add weight with the barbell. Consider pairing squats with glute bridges, as the bridge mirrors the strength benefits of the squat, but has the added benefit of being a pure hip extension movement, which is important for hamstring rehab. The bridge, being technically easier than the squat, allows for people to develop faster strength gains, while someone who is inexperienced with squats only would otherwise miss out on. In this phase, you should be starting Nordic hamstring curls, which have been shown to prevent hamstring re-injury rates by up to 51% in some athletic populations. In the next video, we'll be diving into this exercise and how to perform it with some regressions. Thanks for listening. Nordic hamstring curls are a must for any hamstring strain prevention or rehab program. Eccentric hamstring exercises have been shown to be more effective than concentric exercises in the prevention of hamstring injury. This exercise is quite easily performed with a partner holding your feet. However, if you are training alone, you can set up with a barbell and weights or with the Smith machine in a locked position. The goal is to lower yourself to the ground at a controlled pace until your hamstrings can no longer take your weight and you fall forwards. If you can't go very fast, some regressions are using your hands once you get to your failure point and starting to lower yourself down. However, if this is too low for you to do, the use of a pole if you fail early can allow you to get down to the ground in a controlled fashion. If you find this too difficult to use, the use of a resistance band across your chest can also allow you to get through greater range of motion. Performing Nordics 2 times a week for 13 weeks has shown a significant preventative effect on hamstring tears. However, if you are rehabbing a strain, performing Nordics up to 3 to 4 times a week is possible depending on your symptoms and the stage of the injury.